After we have massaged the right leg and arm, we transfer her into the side-lying position, her left side up. Technique 35. Palm press on the straightened leg. We are palm pressing with both hands at the same time her upper and lower leg towards the knee and back. Technique 36. Palm press on the flexed leg. In a half-kneeling position, we massage her upper and lower leg with palm pressing at the same time towards the knee and back. Technique 37. Foot press against the back of the thigh. We sit between her flexed and her straightened leg, foot pressing the back of the thigh of her flexed leg towards the buttocks and back. At the same time, we pull a little on the foot of the flexed leg and support the knee of the straightened leg. To increase the pressure, we can use the heel or the edge of the foot. Technique 38. Pulling the rectus femoris. With our feet tucked between her upper and lower leg, we alternately pull with our fingertips on her front thigh muscle from above the knee towards the groin and back. Technique 39. Relaxing footwalk. With the balls and heels of our feet on the muscles on either side of her spine. Her spine runs protected under the arch of our feet. We start at the lumbar region until before the scapulas and back. We hold her straightened arm backward without pulling. Technique 40. Side bow. Out of the previous position, we grab her upper leg above the ankle joint and stabilize with one foot at the pelvic arch, still holding her arm. While we pull the leg backwards, we press with our other foot the muscle above the spine at the lumbar region. We pull only slightly on the arm. Technique 41. Knee pivot, hip and upper leg stretch. Sitting on one of our heels, we stabilize with our knee her buttocks. With both hands, we hold her upper knee from underneath. Our other knee is placed against the back of her thigh above the knee crease. In an imaginary semicircle, we lean backwards, causing the knee press against her thigh, which creates a stretch at her front thigh and hip. This way, we continue pressing towards her buttocks and back. Technique 42. Upper leg, pelvis, waist stretch. Still stabilizing her buttocks, we sit lower. One hand supports her upper thigh close to the knee. As we lean backwards in a semicircle, We push her shoulder downwards with the other hand. Technique 43. Crossbow back stretch. We grab the wrist of her upper arm and the ankle joint of her lower leg. One foot is placed lightly above her spine in the waist. Standing, we pull her leg in a semicircle towards her head. Her arm is just supported. Our foot can also be placed on her buttocks or hip. Technique 44. Arm extension by heel pressing down and outwards. Technique 45. Palm press on the outer arm. Simultaneously palm pressing the upper and lower arm towards the elbow and back. Complete with another arm extension. Technique 46. Triangle position arm stretch. At the same time, we heel press down and outwards, her fingertips pointing towards her feet. Technique 47. Shoulder rotation and arm press on the outer sand line. With both hands, we grab the shoulder like a ball and rotate backwards a few times. Then we perform a half rotation backwards, finishing with leaning into an arm press against the waist area above the spine. Technique 48. Thumb press along the outer border of the scapula with pulling the arm. We guide the arm to behind the head, holding on the wrist. We pull a bit at the arm at the same time we thumb press along the outer border of the scapula. Release pulling and pressing at the same time. Technique 49. Toes under scapula. We insert our oblique pointing toes as far as we can reach underneath the shoulder blade, from the upper angle to the lower tip. The straightened arm we just hold backwards. Technique 50. Pulling spinal twist. We stabilize her buttocks with one foot, the other is tucked under her 90-degree flexed knee, with the shin bone supporting the back of her thigh. We pull the lower arm firm and slowly through leaning back. The upper arm is placed above the lower arm. We transfer the recipient into a side-lying position with her right side up and repeat the techniques 35 to 50 on her right side.